The DSS Mental Health Kiosk System. Computerized self-assessments can help collect meaningful clinical information, but many patients cannot use typical user interfaces due to cognitive disabilities, limited literacy, or low levels of computer experience. The DSS Mental Health Kiosk is designed to overcome these obstacles and will capture clinical information directly from patients, summarize self-assessments, and provide patient education. Clinical kiosk system components include a client executable touchscreen patient assessment system, a touchscreen client interface from which the client can perform assessments and receive printed feedback, and a kiosk controller or administrative module, which distributes the selected assessments to a particular kiosk for patient execution and delivers the results back to Vista. Completed assessments appear in CPRS as unsigned progress notes for review by the assigning provider. The Mental Health Kiosk application requires data from the following Vista components: the Mental Health Assistant, the Instrument Authoring Tool, and various patient files. The Mental Health Patient Assessment System is a touchscreen client application. The system administers assessments using a touchscreen kiosk equipped with headphones. It allows the patient to take mental health assessments and have the system record their answers. Here is how the Mental Health Kiosk system works. A VA staff member starts the kiosk from the administrator module and initiates the assessment. The patient assessment system receives a command from the administrator to begin. The patient must enter their last name and social security number at the appropriate kiosk to start the assessment. The system will not allow a patient to duplicate an assessment within the same day. The system then displays the assessment one page at a time. Each question is displayed and read aloud.
Please read each item carefully and select the answer that best describes you. Have you ever felt you should cut down on your drinking? Tap the desired choice with your finger.
The system displays multiple buttons on the screen, each of which has text and a graphic representation of the response for the button. When the patient presses a button, the response for the button is read aloud and recorded by the system. When a user has selected their final response and is ready to move on to the next page, they pressed the Next button. A Help button provides assistance to the user. If the patient does not respond to the assessment, the system will ask if assistance is needed. The instructions will repeat after 2 minutes of inactivity. If there continues to be no response, the system will end the assessment and close the application. The next time the patient identifies themselves, the system will take the patient through identifying their previous responses. Once an assessment is completed, the patient assessment system will print a report for the patient summarizing self-assessment findings and will present educational information based on patient responses. This data is also delivered back into the mental health package for access by the clinician to facilitate more timely interventions and better point-of-care decisions. Contact DSS Incorporated for more information on how to acquire the Mental Health Kiosk System for your facility. Thank you for your interest.